there, it's Dr. Hanson with Hanson Chiropractic and Injury, and today I have a patient named John. John, you've been coming in for about the last 6 to 8 weeks. Yeah. And were you a patient here years in the past?
Yes.
Yeah, a long time ago, right? Mm-hmm. Yeah. So we've all both gotten a little bit grayer.
Yep.
Yeah. So John came back into the office because he was having a lot of troubles with his neck, upper back, and then this area in the mid to low back called the thoracolumbar junction. Today I'm going to take you through what I've been doing with John and just explain to you a little bit about how the type of work we're doing has been able to correct and help him out. And if you just want to let everybody know, John, as far as your pain and how you've been feeling since you started with us on a percentage basis, how much better are you feeling now than when you started?
I feel like 70 to 80%, but I've moved pretty good now.
Yeah, very good. Yeah. Good. Well, let's show them what we've been doing for you, okay? So if you just want to take your glasses off, you can just put it right here. And I'll have you go ahead and lay on your stomach face down then.
All right.
Okay. So with John, a couple of his big postural issues is his head is carried forward, his rib cage carries back, meaning too rounded, and the center of mass of the rib cage is behind the center of mass of the pelvis. And that creates compression down at the base of the back, what we call the TL or thoracolumbar junction, and then the cervical thoracic junction. Those are basically the two areas of the spine that have a lot of mechanical stress being put on them, okay? So I'm going to start. We're going to be working through his SI joints to start with. Just separating right here. You can see I'm being pretty firm with John. You know, the type of adjusting we do is very specific. I know John has a little bit of osteopenia. Yeah, a little bit of osteopenia. So a little less calcium in some of the bones. There we go. But when we're real specific, we use the drops. We're able to work real gently on people. And so even if you have like osteopenia, or you've been told by your doctor you have osteoporosis, there's still techniques that we can do in chiropractic to take care of you. Work around that issue, okay? So like I said with John, his lower back, posterior weight bearing. So basically think of the whole lumbar spine shifting posterior towards the back. So I was working to improve that curve in the low back there. I'm going to have you lay on your back now, John. All right. You're moving around. You flip over there a little easier now, don't you?
Oh, yeah.
Yeah. Let's have you go ahead and sit up here.
Sure.
Good. And then all the way back here. There we go. So again, we release that mid to low back area. Now I'm going to have you scoot down a little bit there, John, right to there. And we're going to kind of open up the chest a little bit. Okay? And so, again, shoulders, very classic posture. Your head goes forward, rib cage rolls back, shoulders internally rotate. I'm exaggerating, but that's the general posture. So if you'll notice what I'm doing is basically the mirror image or opposite of that. So I work through the AC joint, sternoclavicular joint, and then the rib heads as they come into the sternum. And this just opens up the chest. And again, we're shifting his whole frame to a more neutral position, okay? And that's what takes stress off of the connective tissues and allows him to really heal, okay? All right, there, John. Enough tough love for you today?
Yeah.
Let's have you go and come on up here.
Okay.
I'm going to have you just stand facing that wall. There you go. Man, no, you always just automatically go into that stance, don't you, John?
Yeah. There you go when you face the wall.
Reach for the sky, huh?
Yeah.
All right. So I'm going to work on, again, creating more external rotation into his shoulders. And this instrument fires what are called proprioceptors and mechanoreceptors. These are like nerve sensors or endings in the joint. I'm going to pull you way back here. And again, I'm stimulating these nerve receptors to deal with position sense.
That spot.
That's the spot. Now you stay right there. Okay, and then just relax. I always let you get your center back. Okay. Good. All right, there, John. Okay, now go ahead and turn and face towards me. Yeah. So, really good changes, right?
Yep.
So what we've been able to do with John is John came in and his posture was like this, okay? And that was creating all that strain that ultimately was creating the pain that he was feeling pretty much through the whole spine. And what we did is not just work on the muscles and the soft tissues, but really work on the frame and correcting that to take the stress off those tissues so they could actually heal. Right on?
Yep. All right.
That's good. Awesome there, John. Now you can go dancing. Get out and you betcha. I like it. Good. Hey, listen, we love taking care of people. We have a good time here. Yep. And we just love our patients. We love being able to make changes in lives. It's never too late. You can get changes with chiropractic. There's gentle ways to take care of you if you have any kind of fragile issues. So don't hesitate. Give us a call, Hanson Chiropractic and Injury, and we'll see y'all soon.
Good.